morning, everybody. Thanks for joining today and good to see you all. Just want to note that I have to leave a couple minutes before 10 a.m. So if we're still going and I disappear, don't take it personal. Really just want to start by reminding every veteran in Snohomish County and really around the region that Veterans Affairs medical system is now providing vaccinations to veterans. And we really want Snohomish County's veterans to take advantage of that service to ensure we're maximizing all the available resources for getting our residents vaccinated. So, we have many people who have served at Naval Station Everett, Whidbey Naval Air Station, or farther afield in Bremerton or Joint Base Lewis McChord, who eventually settled here in Snohomish County. So we're a very veteran-friendly county and want to make sure you get vaccinated. So check with Veterans Affairs. We also want to make sure all those who have served our country can get this benefit from their service. So also wanted to add that the 5th mass vaccination site at Angel of the Winds Arena in Everett opened last week. It's a great addition to our system. It's a walk-in site, again, by reservation or appointment only. The leadership of Angel of the Winds has just been fantastic through the COVID virus pandemic. During the start of the pandemic last year, they stepped forward really without hesitation when we needed an isolation and quarantine center early in the year. And now have stepped forward again to help with vaccines. So we really appreciate their willingness to offer their space for this activity. Thank you so much. And all of our partners who have provided space for mass vaccination sites are playing a really critical role in ending the pandemic and protecting our community. So thanks to all our partners. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers. Good morning, everyone. I have just a few brief comments today. Yesterday, we published the new case rate of 84 cases per 100,000 for the 2-week period ending Saturday, March 6th. This represents another 20% decline in the case rate since last week's reported rate of 104, and it's the first time in nearly 5 months where we've had a case rate under 100. So I think we can all feel good about that, but also yearn for more. It's good news, and we're continuing to move in the right direction as long-term care cases, hospitalizations for COVID, and deaths have also declined in parallel fashion. For details and more information, see the case counts page on our website. A large part of this is the result of an increasing number of residents and staff in our long-term care facilities getting vaccinated, as well as more of our older adults across the county also getting vaccinated. We estimate that through February 27, about 10 days ago, at least 1/3 of individuals over age 65 residing in Snohomish County had received at least 1 dose of vaccine. Thousands are getting vaccinated every week here in Snohomish County. Approximately 13,000 doses were administered during the last week of February, and 17,000 doses were allocated during the first week of March. We'll have updated figures on allocations and doses administered later this week on our website on the vaccine page. Recently, the state's emphasis has been on allocating doses dedicated for dose number 2 of the Moderna and Pfizer preparations. Our overall primary challenge remains getting sufficient supply to meet demand and our capacity to administer it, especially of doses authorized for use as dose number 1. The arrival of the Johnson & Johnson vaccine on the scene last week offers hope for augmented supply in the long run, but that won't really manifest until later this or early next month as manufacturing and distribution of that product picks up. We do have preliminary allocation information for this week. Right now, we are expecting to receive about 21,000 doses countywide, about 90% of which are, as I mentioned earlier, directed toward dose number 2 of either the Pfizer or Moderna vaccines. We have yet to get information on the allocation to the federal retail pharmacy program this week. That's doses allocated directly from manufacturers to local commercial pharmacies via a relationship with the federal government. So our countywide total will likely be higher as the week progresses. As Executive Summers mentioned, Angel of the Winds will be open most of this week using the Johnson & Johnson vaccine, and some other sites are anticipated to be opening for appointments soon. Again, mostly targeted towards second doses this week because that's what we've been allocated. Turning from vaccines to a related prevention topic, the CDC updated some guidance for fully vaccinated people yesterday. For the purposes of this guidance from CDC, people are considered fully vaccinated for COVID-19 when it has been at least 2 weeks since they received the second dose of the Pfizer or Moderna vaccine, or at least 2 weeks since they're receiving the Johnson & Johnson single dose vaccine. Once fully vaccinated, the following recommendations apply in non-healthcare settings. You can visit with other fully vaccinated people indoors without wearing masks or physical distancing. You can visit with unvaccinated people from a single household who are at low risk for severe COVID-19. You can do that indoors without wearing masks or physical distancing if you wish. You are also able to refrain from quarantine and testing following a known exposure as long as you don't develop symptoms of COVID-19 during that 14-day follow-up quarantine period. That, you know, you don't have to stay home, but we should all remain alert. And even if we're vaccinated, if we develop symptoms, we should then self-isolate and seek testing. But you don't have to stay home if you're fully vaccinated during that time. These recommendations will offer potential relief for residents of long-term care facilities and their families who long for one another's company and support. They may also permit small social gatherings among fully vaccinated individuals without having to adhere to the prior recommendations for face coverings, social distancing. Having said that, keeping gatherings well ventilated and sparse, I think, is still a good idea till we get further down the road. This will also help mitigate the financial impacts or lost work days or school days due to the previous need to quarantine if exposed to a confirmed case. However, we are a county within a state and with a unified public health system, and so a few things need to happen before we can fully endorse and implement these CDC guidelines locally. Remember that state directives addressing visitation in long-term care facilities will need to be updated. The health district is obligated to uphold the state's requirements, and we cannot implement this CDC guidance until adopted or adapted to the Washington state by the governor, the Department of Social and Health Services, and/or the Department of Health. Likewise, we want to maintain harmony with statewide guidance addressing social gatherings, and we'll all stay tuned for any updates there as well as this guidance is vetted and its adaptation or implementation evolves in the coming days and weeks in Washington state. Until then, current state requirements remain in place. I'd also like to point out that the CDC recommendations do not eliminate the recommendation to wear masks when out in public venues, even if you have been fully vaccinated. For now, fully vaccinated people should continue to wear a well-fitting mask and watch their distance when in public, both indoors and outdoors. This also applies when visiting with unvaccinated people who are at increased risk for severe COVID-19 disease, when visiting others who have an unvaccinated household member who's at risk for increased risk for severe COVID, or when visiting with unvaccinated people from more than one household. To keep it simple, I would suggest that you just continue as you've been doing, but realize that if you're together in a private space with another household and you've both been fully vaccinated, then I think you can let the mask down. It is also still recommended that all individuals avoid medium and large size in-person gatherings. Again, we're still in phase 2, so keep it to 2 households and no more than 10 people. And if you develop any COVID-like symptoms, seek testing and isolate until you receive results, regardless of whether you've been vaccinated or not. People should also look for and follow CDC and state travel requirements and recommendations. Those can be found on the Washington State Department of Health and Centers for Disease Control and Prevention websites, or you can probably just Google travel requirements, CDC travel requirements, WA, DOH, and get the same page. And remember that your employer may have more stringent requirements regardless of vaccination status, particularly but not limited to healthcare settings. So please follow the guidance issued by your employer with respect to your activity at work. And with that, I'll turn it back to Executive Summers.
Thank you, Doctor. First question is for you. Do you believe the 20% drop in case rates is an indication the plateau is over and we're on the decline again?
Well, I think if you look at the shape of the curve, which you can do, but it's basically serial 20% declines that we've had for several weeks now. So if you do the math on that and you draw it out, you do get a curve that starts to flatten. It's sort of, if you think of it about, as say, if you're standing across the room from a wall and you keep walking halfway to the wall, you never quite get to the wall, but you know, in each step, each time your distance traveled decreases. So proportionally, we're still going down 20%. I think that's good, but that's kind of a natural phenomenon. That's kind of the math of how these things work. So it's expected what we're seeing.
Okay, the next one, if we continue to see a decline, would you want the state to create a phase 3? Do you want to start on this?
Well, I imagine you might have thoughts on that too, Executive Summers. From the public health disease control perspective, you know, certainly we only want to impose restrictions on people's lives, education, commerce, employment, etc., only as long as it's necessary and to the extent that is necessary to protect human health and prevent transmission of disease. So I think it's a corollary of that as we make more progress, we will look for the restrictions on society to decrease. And I imagine that work is, I know that work is ongoing to draft that. And Executive Summers, do you have more knowledge on that?
Yeah, we very much encourage the state to identify a phase 3. We want to open safely though, and so we're aware that they are working on a phase 3 and what those criteria would be. So we support that. Again, we want to make sure that as we open up, we don't backslide and end up having to close things back down again. So we need to proceed carefully, but we're also aware that people are hurting and businesses are hurting, and we want to give them relief again in a safe manner. So yes, we support a phase 3 and moving forward cautiously. And there's a follow-up question really, are we hearing the governor will come out with phase 3 guidance this week? And that includes vaccination minimums as one of the metrics. Do you have any information on that, Doctor?
What I know about the governor and the Department of Health have been engaging local public health and I think local government around what the parameters would be for entering phase 3 and what the metrics would be for tracking progress and what the liberties would be that are afforded that. And as far as I know, it's all in draft form. Certainly I'd heard vaccination metrics listed. I think from the public health end, we have some concerns about that. I think, speaking for my part, the main thing we want to focus on is keeping our eye on the thing we're trying to prevent, which is suffering, hospitalization, and death. And so monitoring those are key, and we'll see what comes out. What comes out of the mix after all the state and their local partners have had their say.
Okay, the next one is regarding vaccination of teachers. It wasn't the county's decision to vaccinate teachers, but that is surely going to widen the inequities in who's getting doses given educators' background. So what do you make of that? I just want to say, I think, I've supported for some time vaccination of teachers if we want to open up schools and we're asking them to go back to in-person learning, that was the right thing to do. In terms of inequities, we're going to continue to identify groups that don't not have equal access. Maybe they don't drive, or they don't have computer access, or there's a whole number of hurdles. So we are focusing efforts to alleviate those inequities. And I also want to say, though, that a lot of families who are service providers and working on the front lines have children, and they've been severely hampered by having kids at home and having to teach at home and that sort of thing. So I think the inequities and inequalities go in many different directions, and I think getting kids back into school and helping families in that manner is a good thing for many people. So, Doctor, do you have any other?
Well, I just, I was, you read my mind, your last comments there, that getting schools going again is an equity promoting endeavor, both in terms of the well-being of the children and their families. So yes, there's it's a younger, whiter group of people getting directly benefiting in terms of the vaccination, but the branching benefits, I think, are more widely shared. And also mitigating, our hope is to mitigate the impact on, as you said, Executive Summers, on our remaining 1v1 elderly adults in our community, again, which roughly 2/3 are still looking to get that first dose. So we've got a ways to go there. And toward that end, we're really grateful to the schools for working with commercial pharmacies and some healthcare partners in the community. Virtually all public school districts are now connected with a pharmacy and or a healthcare system to carry out this vaccination, so that there will be less competition in the mainstream. One, it'll help them get it done efficiently for their workforce, and two, by doing it that way, there will be less competition in the main avenues like the mass vaccination sites and the high volume healthcare provider systems for spots that we do want to still prioritize in the effort to get our elderly folks vaccinated. So I think this is a win-win. I think when we look back a month or two from now, it'll turn out to have been a great move.
Dr. Spitters, regarding herd immunity, people have tried to pin down a percentage like 70 or 75% immunization. Is it even possible to come up with an exact number like that? And also, some health experts now say the goal is not herd immunity, but vaccinating to prevent severe illness, hospitalizations, and deaths. Any thoughts on that?
Well, again, first, just to set the stage, herd immunity would be the concept of having enough immune individuals in the population, a sufficient proportion that the that the virus starts bumping into people that are not susceptible anymore, and then it has nowhere to go, and then transmission dies out. So for some viruses, like let's say measles, it's so infectious, it's a very high, like 90–95% immunity is needed to block transmission in the community. For other things that are harder to transmit, it's lower. It's out of my strike zone to come up with that number. There are modelers and epidemiologists in the scientific community working on that, and I've seen anywhere range from 40 to 80% with the bulk of guesstimates up at the higher end of that. So the numbers you mentioned are probably somewhere in the ballpark based on what's been published, but I can't assign a number or really endorse any of them. It's not really in my wheelhouse to do that. But I think the goal ultimately, as we've all stated all along, is to get everyone in Snohomish County who wants to get vaccinated as quickly and fairly as possible. And likely we will reach a point of sufficient immunity in the population before we reach that ultimate goal of complete coverage, where transmission dies out. And then we might have a challenge of motivating people who otherwise would want to get vaccinated. Let's go get vaccinated, even though the crisis is over. And then last, just a comment, of course, we want to achieve sufficient immunity and coverage in the population to carry us through. And at the same time, in the immediate future, our imminent, our first goal is to stop the death, hospitalization, and suffering that's occurring, particularly among our elderly and medically vulnerable members of society. And so these are not mutually exclusive goals. I think they're serial goals. The first one, and we're seeing it happen, is let's get the hospitalizations and death down, and then keep marching forward to try to stamp this thing out so that we don't get a wave number 4. And so that's what I really see as our challenge laying before us at this moment.
Okay, a couple of questions on vaccines. Now that we're 3 months into vaccine rollout, will provider level dose allocations be made public?
I'll have to check with the state on that. I don't know. Again, the allocations come from the state to the providers, including to the health district and to the other providers that run the mass vaccination sites. And so I'm not sure that, I'm the policymaker there. So we'll look into that and get back to you.
Okay, and has the Department of Health provided any 2-week forecasts? I assume that means advanced warning about how many vaccines.
Yeah, they have, and roughly it's around. They have. I think that went out in an email to all interested parties, but we can certainly get that forwarded to you. I think it's roughly 300,000 doses this week, and then it bumps up to 320, I think, next week, and 320 the week after that. Those are approximate numbers. Over the next, the next, and the following week. So they do seem committed, and the federal government seems committed to supporting state government in providing that picture forward. And I know the state is also then working on how do we translate this into counties being able to see downstream as well.
Okay, and where are we at with wait lists for vaccine appointments or special days at sites for seniors, which we mentioned before? And I understand that the new scheduling system, PrepMod, actually has some capability for wait lists. You want to address that?
Yeah, that's my understanding as well. And folks who call into the health district's COVID vaccine hotline, one of the services available on that line is they, at the other end of the phone, they register you online, and if there's no space available, they can get you on a waiting list where you would get a call back too. We're trying to, that's for eligible folks with an emphasis on those who are elderly, unable to navigate, the internet system for doing this, or otherwise can't access the internet. So we don't want everyone calling into that line, or we'll get inundated, and those people whom we've dedicated that effort toward could get diluted out. So just keeping that in mind, but there is a means to do that.
So I'll read this next one and then make just a brief comment, then I'm going to have to drop off. But in the county's discussions on phase 3 framework, have county leaders heard any inklings that counties might be breaking it county by county again versus continuing to use a regional method, which combines, for example, Snohomish, King, and Pierce as a region? I will just say that the regional approach has been roundly disliked by everybody, most counties, and that's been expressed to the state, and they've taken that under advisement. But it's kind of a two-edged sword. Some counties don't want to be held back by the counties they're tied to, and other counties it's just the opposite. Don't want to jump out in front and create problems for surrounding counties. So it's a bit of an awkward situation, but we do know the state's looking at various different approaches, but don't have any specific knowledge if they're going to change the regional approach. So Doctor, I'll turn it over to you, and I'm going to have to drop off, and wish everybody well.
Thank you, Executive Summers. So I see a question, when do we see the first dose, second dose allocations on a weekly basis evening back out, right? We're at 90-10 for this week, and we're working with the state on that. And you know, some of it's an accounting issue where we're getting allocated doses based on the state's knowledge of the number of first doses that have been given. And so we too want to see you know, people finishing their 2-dose series, but also having the opportunity to get started. As I've said twice now already, we've got you know, roughly 80,000 people over age 65 in Snohomish County who are still looking for their first dose. So we got to get that rolling.
All right, there's another question in here. Is Veterans Affairs offering vaccines to all veterans, even if they're not in the current 1B1 category?
And I believe that they're offering it to eligibles, you know, so just 1B1. And if I am not correct, we'll get back to you on that.
I just found some additional information that they are offering vaccines to veterans who receive care through the VA and are at least 75 years old or older and have underlying health problems that increase the risk. And they may be, some facilities are also offering them down to veterans 65 and older.
And yeah, and I also see a note indicating that the VA Puget Sound healthcare system, which I believe is headquartered in Beacon Hill there in Seattle, announced this week that they are now vaccinating veterans of all ages. So I apologize for mixed messages. I can't reconcile those. But I think if you're a veteran, and one, we encourage you to get vaccinated. Two, I think the best thing to do is call your you can either call 206-716-5716 to schedule or to get your interest in vaccination, you know, lodged with the system. Again, that's 206-716-5716.
Okay, there's a follow-up question to the forecast, the 2-week forecast. And whether the state has started giving the county its own 2-week forecast, which the state has been promising, as opposed to the federal 3-week forecast.
Well, now that the federal government is giving the state the 3-week forecast, the state is just started developing a process whereby the end product of that process would be a 2 or 3 week forecast at the local level. That's probably going to take a couple of weeks to work through and establish that process.
Okay, that looks like all of the questions that we have. This is Kristen in the Joint Information Center. Thank you again for joining us today and for all of your questions. We are going to go ahead and wrap up. Please stay tuned for future media availabilities.